Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left quadrant. The lower left quadrant on the panoramic view shows us BTRs and grossly carious teeth. Now we're going to take you to the each and every tooth. This is the first premolar right there. This is the transaxial view. There we go. So the transaxial view shows us that the first premolar is just BDR's left now. As you can clearly see, we've got a periapical radiolucency present as well. Moving distally towards the second premolar, this is where we are. This is the second premolar, and here we can see we've got a periapical radiolucency. We've got roots which are completely destroyed. We've got grossly carious BDRs. And the distance from the periapical radiolucency to the mental foramen is approximately 7 millimeters. Moving to the second premolar region, this is the second premolar. There we go. This tooth is also very grossly carious. There is root resorption, as we can see here, that this tooth seems to be fractured. The segment that we showed you, BTR, was one fragment, and this is the crown portion fragment right here. So this is where we can see that this is the crown portion, and this is the root portion of the tooth. So this is a fractured tooth, and very severely affecting the ridge. As we are moving distally, this is the lower left first molar. The lower left first molar, unfortunately, is very grossly carious, especially on the mesial aspect. So this is the mesial aspect. We can see extremely carious. We can here see this is the roots. The mesial roots are fused, and there we go, two fused mesial roots. Moving to the distal side, the distal contains a periapical pathology as well right there. Another very interesting thing to note is that this periapical pathology has eaten away entirely the buccal bone on the 6, whereas the lingual bone is still sufficiently holding very well. The lower left second molar, this is the lower left second molar. We've got lingual fossa. At the same time, we've got approximately 5.5 to approximately 13 millimeters of bone present in the lower second molar, but this is a lingually inclined ridge with little bit of thinning there. So the buccal side, we will have a defect here. This is this particular aspect, this aspect, right? So this we can see you've got a slight buccal depression there. The bone is not holding up very well, but otherwise we can see we've got two cortical plates, we've got cancellous bone. The bone quality in all this region is D2 and D3. We've got the cortical plate is very severely atrophied. At the same time, something very noteworthy is the region of the 5 and 6. These are very vascular bundles that are present in the around the inferior alveolar nerve and present in the ridge of the lower left quadrant. So this is something that needs to be very carefully examined by the doctor when the extraction is being done. They will need a very good grafting material. They'll need very good hemostasis, and this area will definitely bleed quite significantly. So this is something that they need to keep in mind when they're treating this particular area. So if there are any further questions regarding this case, please feel free to reach to our team. This is the axial view. We'll show you the axial view of the lower arch. So we can see that this is the fractured lower left segment, this lower left second premolar. We've got very damaged and atrophied ridge around the premolar radiolucency. This is the mesial root of the lower left 6. This is the distal root. This is the distal pathology. Here we can see that this is the area where a lot of vascularization is seen. There we go, there, and this is all associated with the mandible. So this is something to be very careful of. Just to quickly show you a big coronal view. So this is the coronal view. On the coronal view, you can clearly see. There we go. This is the coronal view. Here we can clearly see that this is the left hand side. This is the right hand side. The left hand side, we've got slight little bit of a problem there. There we go. So this is how the lingual fossa is very deep, and it is visible on this section very significantly. So, and this is where the lower left second premolar is fractured right down the middle. Thank you very much.